So I am Bruce Stevenson, half of today's dental consulting, along with Linda Piccinini there on the left. And this is the second video, part two of the video we've done with Divergent Dental. The first video talked about using the morning huddle to manage your day in the office. This video is going to talk about the second daily report, which is the daily dashboard, but also some of the other reports that are very useful in Open Dental. And particularly the first part of this video is going to talk about using the daily reports of Open Dental to do a bonus system. So we don't get anything from Divergent Dental or from Open Dental, but we find that a lot of people don't know about the possibilities, and that's the purpose of this video. Okay, so this is the second report that comes out daily from Divergent Dental that I think is so valuable for a practice. And we were talking before about bonus systems. Bonus systems have a reputation, they don't work. And that's true, they don't, because they aren't done properly. But if you have a bonus system based on collections, not on production, now, basing it on collections makes it much harder to do if you're going to do it yourself in the office. But one nice thing about Divergent Dental is it does it all for you. So here you've got collections right in the middle in there. Collections are hard to fudge. Okay, it's easy to fudge net production. Okay, and it's easy to fudge the percentage that you collect, but it's very difficult to fudge income. And so I think income is the single most important metric. So if I'm going to do a bonus, I want to do it on income, because that's what I'm going to use to pay the bills as well as the bonus. And I don't want it to be the same amount month after month, the same baseline or goal month after month. It should be increasing over time, not real rapidly, but increasing slightly, so it gets a little bit harder to get the bonus, so people work a little harder and the office profits from that by collecting more money. And this, again, automatically can go up. Now, if your default is 5%, is that right?
That is right, yeah.
Yeah, okay, but if you got a starter practice and you're taking off like a rocket, 5% is going to be too low. Anyway, so getting back to the bonus. How do you do the bonus? Everybody can look at this every day, because this comes like a morning meeting. The daily dashboard comes every single day, and every person can look at it. You can send an email to them, or you can print it out and put it on the refrigerator in the break room. So Linda was always a bonus coach. So some staff member needs to look at this and remind the staff, hey, we're looking at the income for this month and we're in red. That's not too good. Okay, here's where we should be so far this month. Okay, and we're well below that. So the yellow means we're a little bit closer. We still should be here, but we're a little bit closer at least. Okay, I think let me just look at another one here. Okay, so here, oh man, they almost made it. We're looking towards the end of the month here. Okay, we're almost made it there. Okay, we're a long way to go from new patients. Okay, again, and just looking at some examples in here. Oh, this is better, except the income. Look, we met our goal for the net production. We met our goal for the new patients. And some offices will give a bonus on all three. So this is the biggest part of the bonus. When the office makes this, everybody gets X number of dollars. And one office that I'm thinking of said, okay, well, I want to bonus them on these two things too. And so they don't get X, they get half of X in there.
Man, I gotta tell you something
look,
here.
Whoopee, okay. I'm sorry, go ahead.
I was just gonna say, Bruce, like thinking about like the iterations that this different visualization has gone through, it's much cleaner than it first started with. I had this old speedometer thing that just looking back on it was just ugly, but like now the psychology behind color and just like the effect that these different colors have just in our North American culture specifically. Like seeing 2 out of 3 green just feels pretty good. But then, like when all 3 are green, like I can't, I can tell you how many different conversations I've had with different office managers and others who they do exactly what you're describing. They get bonuses for either themselves or their whole team based on these, and they say, "Man, my life when I open my email either at the end of the day or the start of the day, I just feel so much better when all 3 of those circles are green." It's an interesting thing to have that much of a either positive or sometimes negative psychological effect on people's mental health.
Well, if we look at this previous one, okay, where you're so close.
Oh, I know.
Okay. And so Linda would be running around the office with her hair on fire, to say, come on, we got it, just that little bit. Come on, we got a couple more days maybe to
I'm
make
coming
that
in tomorrow and I'm posting the insurance checks we get on Saturday.
Yeah.
Yeah. Or if somebody's calling to cancel an appointment, you should always try to save the appointment, but you might be a little more aware now. Like, oh, Mrs. Jones,
we're
is there
so
any
close
way to keep the appointment?
Yeah.
Yep. I often look like that.
Yeah.
Yep.
So let's see. There you go. You're talking about it. All green.
That feels so much better. That feels so much better.
They need this on the bank accounts. When you pull up your account on the bank, it's all in green.
Yeah. Yeah. And everybody sees this. Okay, either because they got the email or because Linda put it on the refrigerator.
Well, because you always went to the refrigerator, Bruce. I knew you'd always see it there.
Yeah. That's because I spent a lot of free time in there. So, do you guys want to comment more on this? I could probably go back. Let's see. I'm looking for one that doesn't have the picture of the woman.
Just a quick word about the goals that you have there, Bruce. Those numbers we can predetermine them with a formula automatically like you want, but there are some practices that are really goal savvy that will know exactly this is the number I need to hit this month, and so can you make that my goal? And yeah, absolutely we can. Yeah.
I said Linda was sort of the bonus coach, but so was I, and I think if the doctor is involved and the doctor is saying, hey, come on, you're almost there. I want to give you guys a bonus. And I legitimately did, because when they win, I win.
Yeah, absolutely.
But can we do that filling today, or can we do that crown today? Okay, wow, that makes a big difference.
Yeah. So, we're talking a lot about the bonus, but then the advantage of this isn't just the bonus. Never mind, we're not going to pay a bonus, the hell with them. But it's still motivational. It's still the Hawthorne effect to look at this, and I don't think they're going to be as attentive to it as if they were getting a bonus. But everybody could kind of see it still is kind of a game. Okay, how are we doing? Oh, we're so close there. And oh, hey, we almost got it, and then whoopee, there we go. Okay, I think just that by itself is very motivational for the staff, okay, and for the doctor, frankly.
Yeah.
So let's see. I think I've got here's one of your talking about monthly reports. Here's one of your monthly reports. So this is going to come on the first of the month about the previous month, correct? And it's actually got the previous 12 months. So you see you've got some pretty interesting metrics in there for us nerds. But what I really like is this one. How many new patients did you get? And how many people have left the practice? When we talk about, the reappointment rate, okay, this is pretty good, because a lot of times we see that the attrition is greater than the new patients. So you've got a practice that's growing, but is growing smaller. Okay. So I mean, this is one of my favorite reports to look at every month, and also you can see the reappointment rate.
Yep.
over there?
That's the actual attrition list.
Okay, all right.
So out of all those numbers
so
of
these are the
patients
people
you
you'd
have,
like to
that's-
get back in the office.
Maybe.
Yes. Okay.
Most of
that's the
them,
end
most
this-
of them, yeah, most of them you probably want back. But the reality is, as you look through that list, the documents say no, we don't want that person back. Like in this example, sometimes you'll see a balance, and you know, oh, they've got that $577.
I know in my time as a customer of Kevin's, the recall list is one that we leaned on a lot. And that was an easy way to just keep the hygiene schedule full and make more productive phone calls and not just print the one giant 10-page list from Open Dental.
Let
But
me stop.
yeah, so this is that recall list, and as you can see, it gives you 25 names to call here, and this list is populated once a week. So the list you're going to get next week is a totally different list of names than what you're looking at here. So over the course of time, hopefully that administrative team is making more productive phone calls, scheduling more people, and shrinking that overdue recall list as a whole, because we're able to hit more people directly that way.
And
So-
you're not overwhelmed with one list with 10,000 people in it.
Correct. Yeah, correct.
yeah.
Because if you go to Open Dental in that schedule module and you print that overdue recall list,
It's too
be
much.
ready for 10 to 12 pages. Because
Yeah.
Yeah, it's too much.
Now, what
So
other
this-
weekly lists do you have? I recall you had one for treatment plans also.
Yep, there's an unscheduled treatment report as well. And this report, the recall is based on the recall due date, and the unscheduled treatment list here is based on the date the initial treatment plan was done. So we go back and we have certain time frames that we pull those names in from and compile this list every Monday and then send out to you.
But it's going to be a different list next Monday.
Absolutely.
Okay.
Yep.
Yep.
So, I mean, right there we got somebody for $16,000 here. And, you know, that might be kind of towards the top of my call list.
Yeah.
So that's by design too, and like how we lay it out. So like there's different blocks. You can kind of see like on the fees there's a higher fee, but then in the fourth column the date that it was treatment plan. So the first set of patients is the most recent, and it's a full 2 weeks. So it could be like 3-ish weeks that they have been, it's been since they were seen in the office and had this treatment plan. So kind of the sweet spot is that first tier, like we recently talked about it. We're just following up with you, like, so if you're a busy practice, I mean, honestly, most practices, if you have at least a couple people up front, they can get through a list of 20 plus patients to call. But if they can't, you know, honestly, the more recent ones and the ones with a higher dollars the fees, those are the best ones to go for. So the plan is, the list is designed to go out from top to bottom by design. It's some thought put in that. So this is when I talk about the microscope, like our monthly KPI report that comes out once a month. There's a lot of information here, and honestly, I'm not really going to dive into every chart here, but like there's a lot of stuff, but it's not designed to be overwhelming. The place I look at a lot, I do like to look at the broken and total appointments with if I'm doing kind of an onboarding or to dive in with people, I'm going to look at this, and this is looking at how many people did you see, how many people did you mark as broken using the tools within Open Dental or Dentrix with our other customers as well. So that's what this particular section
Wash
does.
your
So
mouth out with soap.
Hey, you know, those are the two softwares we use. We do, the majority of our practices are Open Dental, so we'll just say that.
So
But
Kevin, if you go back to that previous one right there, you know, the nice thing about this with the broken appointments is it's giving you a percentage. So
Yeah.
Open Dental can count the number of broken appointments. But what you really want to know is the percentage.
Yeah, and so the one other thing, let me look. These two actually are the things I think in terms of like, without looking at all the minutia of details of this, I think in terms of like a lot of times the hygienist as well, I don't really have a whole lot of control over how to get my production higher to get different sorts of bonus systems in place. And like, I think these two particular sections right here are going to be ones that you can track to see, are you actually, like, here's the low hanging fruit. Like in this example, they had 46 patients that are minors come in, and they only did 9 total sealants the entire month of December. Periodontal disease is severely undertreated. Let me rephrase that. I think the reality of the matter is, it's periodontal disease is being treated. It's just being coded as prophies.
And people say, well, the insurance companies won't pay for that. They won't pay for root planing. They won't pay for perio maintenance.
That's another issue.
That's another, but that's fixable. It's because you're not documenting it properly. And you document it, they will pay for both those things.
Yep.
Okay.
The front half of this report is all practice-based, right? The second half of this monthly report is provider-based, right? Lots to digest, lots to look at.
Yeah.
If you understand, there's practice numbers and there's individual provider numbers here as well.
Yeah, and so, even if you don't have any associates, most practices will have at least one hygienist, is often more than that, and be able to compare hygienists. And again, do a little peer counseling here for the top hygienist and the not top hygienist.
Yep.
Oh, there's my attritions and down there.
Yep.
There's your spreadsheet. Yep.
Yeah, in terms of spreadsheets, this is the most like easy to look at, easy to read, easy to get a ton of information. It's this monthly report, and I think you can copy and paste. Yeah, so if you can just copy and paste if you want to use it in outside tools. The rest of them are just images that you have to have a little more tech savvy in order to use them elsewhere.
And they're done for you. You don't have to go in. If I have run a report for a month, I forgot how to do that. How did I do that? You've got it right here.
We're not flashy. We're not the most advanced tool, but we're intended to be an easy to use system that everybody can get value from, and that's what the design is, and that's how we operate. And we've had a lot of customers that have been with us for a long time. So my thought is, if it's of value to you, great. And if not, hey, there's other alternatives out there that might be a better fit for you. And if you do it yourself, hey, more power to you as well. That's one of the great things about Open Dental specifically is specifically the native traditional version of Open Dental is with a little bit of intuition and resolve, you can make it do kind of what you need it to do. If it doesn't do it already, you can make it do it. So
yes. I would argue with one point, and you said, we're not the most advanced. I would say advanced meaning useful. That I think Divergent Dental is the most useful. Again, some of these will give you such minutia, but it's not useful in running a practice. Okay, so here not only have you made it easy, but you've made it very useful. So
yeah. Well, thank you. Appreciate that.
Yeah. It's focused data that you need to read when you need to read it.
Yeah.
And if you need to fall asleep, you can just dive into some of the really in-depth spreadsheets when you're laying in bed, and maybe
there you go, right to sleep. Yeah. Works every time. Linda, you've been awfully quiet. You want to say anything?
No, officers need this. I mean, it's gonna make them see the numbers, like when Kevin was saying, our reappointment rate, the staff thought it was 70, or what? Not everybody. We reappoint everybody. Everybody leaves with an appointment.
Yeah.
Yes, doctor. They all get an appointment.
Yeah.
No, you pulled it up. Okay.
Yeah.
And then it got better. Okay.
Mm-hmm.
So, if the office wants to do better, by all means, use Divergent Dental. Get that, and your office will work as a team. There's no I in team. They'll all work together.